Hello and welcome to Quality of Life Radio, hosted by Lisa and Nancy, editors of BigBlendMagazines.com.
Hey everybody, welcome to Big Blend Radio's Quality of Life show, where every third Wednesday we get to chat with Dr. Jackie Eubany about heart health. And Dr. Jackie knows all about heart health because she's a board-certified cardiologist and an electrophysiologist, and she's the author of the best-selling book, Women and Heart Disease, The Real Story. She's on a mission. She wants everyone to get healthy and not have heart disease. She wants us all to put her out of business, right? As a doctor.
No, she wants to retire.
I know. Everyone, womenandheartdiseasebook.com is her website. You can also listen to her past interviews and read her articles on blendradioandtv.com. Just type in Dr. Jackie. So welcome back, Dr. Jackie. How are you?
I'm well. Thanks for having me.
I know the last few episodes of the show, we've been really talking about heart failure, heart disease, all the different ones. Last time it was cardiomyopathy, right? You're making me learn all these big words. It's cool. I'm getting it. I'm getting there.
And you got that right.
I got cardiomyopathy. I got electrophysiology, cardiology.
Yes,
We're getting there. But really, your whole thing is about prevention. And sometimes we find out, we have this, and some of it is hereditary, right? Heart disease.
Right.
So that's an important thing. And today we're going to talk about arrhythmia. And so I immediately think someone's got bongo drums in the chest. What's going on with arrhythmia? These are not like it's like a drummer out of tune, right? That's going on with your heart.
Well, okay, yeah. Well, it has to do with the electricity of the heart, or the electrical component of the heart. So in order for the heart to beat, it needs electricity, and this electricity is what gets generated into the mechanical force of beating. So just the electricity is what you feel when you feel your pulse, or you touch your heart and you hear the beat, beat, beat. So that's the electrical component of the heart. And the electricity flows all throughout the heart and causes that beat, beat, beat. So in order for the heart to function normally, you have to have a normal electrical component, and therefore your heart has to be beating at a regular pace.
Wow, so it's electric. So you want a good rhythm and the electric slide at the same time.
Yes, they're one and the same.
So when they do the pedal thing, they're shocking. They're actually shocking you with electricity, right?
Yes, in order to restart your heart and get your heart rhythm to go back to normal. So that's exactly what they're doing. They're putting some electricity in the heart to just restart, just like you would restart a dead battery. You would, connect it and charge it, and and those kinds of things. So that's what you do sometimes to restart the heart when it's in an abnormal rhythm.
So then why can't we just have a charger when we sleep and plug it into the wall and charge ourselves for the next day?
Well, you would need to be monitored in a hospital setting just in case you don't get the normal rhythm that's conducive to life. So you want to be in the hospital, yes.
Okay, so yeah. Now, arrhythmia. Okay, so what are some of the symptoms for people to know? Just like so this would come before the heart attack, right? This is a symptom of you could have a heart attack, or is it a symptom after?
It could be related to the heart, to a heart attack, and sometimes it's not. Most of the time, it's not, because the heart attack has to do with problems in the blood vessels of the heart. So when you have a blockage in the arteries that supply the heart with the oxygen nutrients that it has, when there's a problem with the arteries, that's when you develop a heart attack. Arrhythmia is a problem with the electricity. So like I mentioned earlier, the heart needs a normal kind of electricity in order to beat. So we say The normal heart rate or the normal heartbeat is anywhere from 60 to 100. So that's the normal range for our heartbeat. If our heart is beating too fast, above 100, we call that a tachycardia, or fast heartbeat, palpitations. Or if it's going too slow, then we call that bradycardia, or slow heartbeat. So it depends on which one you have, will depend on the symptoms that you have, and management, and whatever management we decide is best for your condition.
So is there some, like, if you take your blood pressure, it gives you all those numbers, which I never get straight. Like, everybody's like, oh, my blood pressure is this over this. I'm like, yay. I have no clue what you're talking about. But does that help towards this or no? Because
yeah, it does, because the blood pressure machine will tell you what your heart rate is. So you get a top and the bottom number, that's your blood pressure, and then it gives you a separate number for your heartbeat.
Right.
And you can, you'll know that if your heartbeat is abnormal, it would be either way above 100 or below 60. Or sometimes your blood pressure will tell you if you're having an irregular kind of heartbeat. Yeah, sometimes the blood pressure can be helpful.
Oh, I didn't know that. That's interesting. So do you get any kind of like symptoms of like you need to go and check this out? I mean, I've heard of like chest, your heart is racing, your heart is beating super fast. I mean, it's like I look at people talk about this when they drink these, like those Red Bulls and stuff like these. Can that really affect your heart and make your heart beat fast and then give you,
yes,
what
it can
happens
actually
with
it can make your heart beat fast, because these drinks have a lot of caffeine, and caffeine is a stimulant, and the stimulant then causes your heart to race. So you can feel symptoms of what we call palpitations or fast heartbeat. Sometimes people feel lightheaded. Sometimes you feel short of breath. Sometimes you can get, chest discomfort associated with it, which would let you know that there is a problem.
Right.
You should seek medical attention for.
So it could that lead to arrhythmia, or are you getting it? I mean, how do you get it?
Yes. Yeah, so a lot of times for arrhythmias, you're either born with some abnormality in your electrical system that just, it's kind of like a circuit that's out of whack, that just fires out of control and causes your heart to beat really fast. And like I mentioned before, that symptoms associated with your heart beating really fast would be things like chest pressure, shortness of breath, lightheadedness. Some people can even pass out from these symptoms. And what happens is you get these symptoms, they last for 20, 30 minutes, even an hour, but then they go away. So they come and go because your heart can sometimes reset itself into a normal beat and your symptoms just completely stop. But sometimes it can't reset itself, and then you should go to the emergency room to get some medication to help reset your heart.
Wow, this sounds like a computer. It really does. I mean, it's like you try to do the reboot, and if the reboot doesn't come back, holy hell, because somebody's got to help, So you pass out. I mean, I know people do, like Nancy, you're not good at the heat thing. I mean, could like really hot, I mean, we're in summer right now, and the temperatures are going crazy around the world. Look at what happened in England. And people aren't set up for it and having issues right now. And I wonder, can that set off, a heart issue from extreme heat that you're not used to?
Yeah, so, hot temperatures or being in warm, or very extremely hot temperatures that your body's not used to, that can cause your blood pressure to drop and can make you pass out for those reasons. But arrhythmias has to do more with the fast heartbeat causing you to pass out. And most people will feel their heart racing in association with, the lightheadedness and passing out. But some people may not feel palpitations. But the arrhythmia is a different reason for passing out, as opposed to, being in hot, or, when they tell you not to go into the hot tub, and those kinds of things. Those more commonly affect your blood pressure.
So in the old days when the women used to say they had the vapors, would that be a heart thing?
I
So
don't think
like,
I've ever heard that term. They have the vapors.
yeah,
Yeah, when
so
they're going to pass out.
yeah, they're going to pass out and faint when they, like if they're
Uh,
really emotionally upset.
okay. So that
Yeah.
probably is related to, blood pressure dropping low.
Hmm.
And it could also be related to the heart rate dropping really low as well, that
Hmm.
causes them to pass out. And when they
But they
pass
also
out
wore those
and
clothes, those tight clothes,
yeah, those tight clothes, exactly.
And those
Exactly.
little shoes.
little
Right,
shoes will get you
exactly.
all the time. High heels, too. I mean,
Right.
whoever
I mean,
invented high
they used
heels,
to,
like, stop it.
they just, like in movies and stuff, especially in the South, you always see the women waving their hands in front of their face when people are talking and they get emotionally upset. They've got the vapors,
All
and
right.
then they faint. It's
Oh,
like,
those are from
okay,
those old movies.
I
Yeah.
know.
Yeah. Probably
Hmm.
related to low blood pressures and all. So with the arrhythmias, it's the fast heartbeats that would cause these symptoms of lightheadedness and feeling like you're going to pass out because you're not getting enough oxygen to your
Oh,
brain. When your heart's beating so fast, it's not able to get
Mm.
adequate amounts of oxygen and nutrients. But
that's
when we
freaky.
talk about fast heartbeats or arrhythmias, there are a whole bunch of different arrhythmias out there. And the most common one is the atrial fibrillation. I don't know if you guys have ever heard of atrial fibrillation. It's one of the most common arrhythmias that's here in the United States.
Hmm.
So
And that,
that I was going to say, so that's the most common one. Is that, I mean, when you say there's different ones, is it different rhythms? I mean, and maybe I'm a musician, so I go to different rhythms, or is it a different thing that's happening to your body with
it's
the heartbeat?
so it's an abnormal circuit. So it depends on where in the heart the abnormal
Okay.
circuit is. So they all cause the same symptoms of, your heart rate beating fast, you're getting short of breath and lightheaded, but where they're coming from is different, and therefore we can do procedures to get rid of it or take care of it. So where it's coming from is going to affect how the procedure will be done to get rid of this abnormal heart rhythm.
And does it change according to the reason why you're having arrhythmia? I mean, is it, because I know you talk about smoking and you've talked about drug abuse and things like that on shows, diabetes, all these different things that can lead us to heart disease. Will that change, or is it just your body makeup and how it's reacting at that point? Like, you know what I mean? It's
So we
like if
know
you do
that.
drugs, this is going to do this part. You know what I mean?
Yeah, we know that for the specific arrhythmia, atrial fibrillation, it can happen as a result of having risk factors like obesity, hypertension, diabetes. These risk factors can predispose you to developing this arrhythmia later on down in life. So, living this healthy lifestyle that we're always talking about can help prevent an arrhythmia like atrial fibrillation from happening.
So what
And if
about
you do,
go ahead.
go ahead.
No, I was
I
going
was
to
going to
say,
say, and if you do have atrial fibrillation, living a good lifestyle can help control your symptoms.
Mhm. So if sometimes I've read about athletes who push themselves too far, so that, and then they faint. It's that part of it. Like they just keep pushing themselves to the point of exhaustion. Is
So
that
that could be anything. They could be having a bad day that day. It could be that they were dehydrated. They didn't drink a lot of fluid, and those kinds of things. Yeah. But they could develop palpitations when you're dehydrated. Sometimes it can trigger palpitations or trigger a circuit that you already have in place to be triggered and cause the symptoms of palpitations and shortness of breath. But typically, when a healthy athlete who has no arrhythmias, usually passing out probably from being dehydrated, the sun, or whatever. But if you're ever an athlete and you pass out during heavy physical exertion, you definitely need to see a cardiologist to make sure that that you don't have anything that's dangerous and could potentially be life-threatening.
What about, you okay, sorry, but I'm going there. What about people passing out and dying during sex? I mean, especially like, in all these older movies, they always had like, here's the young woman and the older man, and then the guy died, during the deed. Well, no, but come on, I know people are thinking this. It's not just me. It's a true thing. There was like, oh, he had a heart attack during,
Oh my goodness.
well, because your heart's beating and racing, your blood is doing things, right? And if they were already predisposed, wouldn't that be why it happened? It wasn't just oh my gosh, this woman is, and it's always a man, not the woman. I'm just going in all these movies, right? It's always the man who dies, the Hugh Hefner style. I'm just saying, I don't know how he died, but I'm just saying, you see this and it's like they always use it. Oh, they had a heart attack during it. I mean, you know what I mean, Dr. Jackie?
Yeah.
It
So
can
these
happen.
guys, it can happen. So you need to make sure you have a healthy heart if you're going to be engaging in activities like that, and you need to make sure you're on proper medications and you're taking your medications and you're avoiding medications that your doctors say not to avoid. So these guys didn't just develop heart attacks just out of nowhere. These are guys who already have a sick heart.
Yeah, there already
something as
wrong.
Stressful. Something as that's physically stressful. It doesn't necessarily have to be intercourse, but anything that's stressful can trigger something.
Look how medical Dr. Jackie just got.
But it's true, especially if you're not in shape.
Yeah, and then,
right, exactly.
I wonder,
thing, right?
They're out of shape, and then what about people taking all like these drugs for their their pee-pee, like they're taking all these? No, can't.
Exactly.
I'm sorry, but can it counteract your medication? Or maybe you don't know you have heart disease yet, and then it's like, let me do this, because doesn't that create, I didn't know we were going here, but like we're here now. I mean, but
yes,
but
absolutely.
Seriously, it's a real thing. Can
no,
that
it is
help?
A real thing.
It is? Okay. So
it is a real thing. It's when you're taking these medications for erectile dysfunction, a lot of times your doctors warn you that if you're taking certain heart medications, you shouldn't be taking these medications. So if you are a patient with a heart condition and you are taking medications for heart disease, you definitely should talk to your doctor before starting a medication like for erectile dysfunction, because you can die from it.
And then if you're doing drugs on top of it or something like that, you're on your way, right? That's kind of,
Absolutely.
I look at the drug thing is still happening. Is that something scary for you as a doctor looking at, I think we were having a conversation with a pharmacist the other day, and she was saying this, like this fentanyl thing is where she's based, absolutely horrifically scary about how they, the pushers basically are getting people addicted without them even knowing. And is that something scary for you, seeing what's going on with that kind of drug abuse that people didn't even think? I mean, I knew better, man. It's like the commercials they taught me, in school, when I was in school, like I did not want to be barfing in a toilet in an alley somewhere. You know what I mean? It kind of freaked me out. So I never did it, but like it seems now that I know we have the COVID and the monkeypox pandemic thing going on, but I feel like the drug pandemic is pretty serious still and could really lead to this.
Absolutely. We're seeing a rise in deaths from opioid overdose all across the country. And, legislation passing that, kind of hinders our ability as physicians to give medications, opioid medications to patients who are really in pain because people are abusing these drugs. But it is, it's unfortunate, but it is happening. And, it's a crisis that we're facing in this country today, opioid overdose. Yeah.
What about some of the things that you can do over the counter? Like, the all these commercials for losing weight kind of drugs. I remember something like that a few years. I don't know if that still happens now. Is that still happening where people were taking this stuff where it was presuming it was like really speeding up your body to make you lose weight? And I don't know if that's happening now, but do you see that happening? Those
Not so much. There are actually medications out there that can help you lose weight, but you should definitely be in a program where you're monitored by physicians, where they're checking, to make sure you're not having any dangerous side effects from these medications. But yeah, I remember that one famous one, the fen-phen, that was everybody was taking
that's
at
what I
one
was talking
point. But
about.
but that has since been banned. We don't, that drug is no more.
Oh,
But
that's
yeah,
good.
it did cause a lot of heart disease and a lot of heart problems in patients.
Wow.
But yeah, we have safer drugs out there that can help with weight loss, but you definitely need to be in a program where you are monitored while you're taking these medications.
So speaking of arrhythmia, we're talking about your heartbeat can go fast, 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 right? And we were talking
Yes.
earlier about your lungs. So we always talk about smoking being like way at the top. For this, it's got to be. I mean, I know, I'm sometimes asthmatic, and it's been rare when I get it, but when I do, it's a really scary thing because you can't breathe and you kind of freak out. Like you realize you could just die. Like, you know what I mean? Like if you can't
Yeah.
breathe and control
Yeah,
your breath
absolutely.
and have to push yourself to breathe and calm the hell down,
Mm-hmm.
it's a very
Yes.
freaky feeling. So is that
Yeah.
something like, smoking can lead to that at some point, right?
If you're smoking, it can put you at risk for some kind of heart disease. Yeah, for sure. So it's definitely not a good idea to
I'm not
smoke.
saying you're going to smoke and then all of a sudden you keel over because of that, but you know what I mean? It's like, I just understand that the lungs, if your lungs start to not work and you're feeling, does that could like something, if you have a pulmonary kind of thing, can that lead to arrhythmia in a different way than you're taking
It
drugs because
actually,
go ahead.
yeah, it could. Your heart could start to race because when you're not able to breathe or not able to get enough oxygen, then the heart then starts pumping faster to try to compensate for you not having enough oxygen, and it definitely can make your heart race. And it can lead to, if you can't breathe, if you're not getting oxygen, it can eventually lead to your heart stopping and going into a cardiac arrest as a result of not getting enough oxygen.
That's exactly what happened to my dad. I mean, he had pulmonary fibrosis, he had all these lung problems, but he died from congestive heart failure.
Yeah. Because it can be stressful on the heart.
Yeah.
If you're not getting adequate amounts of oxygen.
Yeah. So, and he used to wear, first he was taking oxygen so many times a day, and then it was like constantly on an oxygen tank. So, I mean, obviously it's very related. If you can't breathe, how does the rest of your body function?
It's freaky. It's a freaky feeling, when I've had an asthma attack, which, I've never had to be hospitalized or anything, but I probably should have. Who knows? But I get through it. Meditation, change of diet, all of that. And I was wondering about that because of that feeling of panic. Like you could actually just keel out just out of panicking and not breathing unless you take control of your body and either get help or, if you really need it. But there's a panic mode when your body cannot breathe. It is a very weird thing. And some people just keel out like that's it, and that I wondered about that, like just thinking about heart disease and arrhythmia. I was thinking about that, like, I know that feeling, and I had to really change my lifestyle to not have asthma because it's a lifestyle thing. But I always wondered if there was a connection between asthma and heart disease because of that panic situation and air to the lungs to the heart,
So asthma doesn't necessarily predispose you to having an arrhythmia, but if you have asthma, your heart will beat fast to maintain oxygen, and you get that same sensation of fast heartbeat, lightheaded, shortness of breath, and and that anxiety-provoking sensation. However, if you have an arrhythmia, your symptoms are very similar, and sometimes it's difficult to tell whether you are having a panic attack or if you're having an arrhythmia, because the symptoms are very similar.
That's a really good point about people with anxiety and having panic attacks. I mean, the world's kind of nuts right now, and a lot of people are having panic attacks, and it's a serious deal. Is that why they say breathe in the brown paper bag thing, right? Calm down.
Yeah, that would help. Yeah, that would help calm your breathing down. But if you actually had an arrhythmia, that would not help. So sometimes it is hard to tell whether you're having a panic, because they present very similarly with the fast heartbeat, like we talked about, the shortness of breath, lightheadedness. So if you're not sure whether you really have something serious like an arrhythmia versus a panic attack, it's always a good idea to go to the emergency room, because really the only way to tell the difference is to do some tests. One of the tests that they would do is an EKG to look to see what your heart rhythm is. And that can sometimes help decipher which is which. Because of course,
this heart is playing jazz, and it's supposed to be playing rock and roll right now. but okay, so one last question here is like, okay, so people are born with heart defects, right, or heart issues.
Yeah.
And once you know that, right? So is that something that you pick up? Like if you take your kid to the doctor, and the doctor is doing a checkup, it's like, hey, there's a little change here in the beat, that's kind of that normal thing. So when things get wonky for you as an adult or a teenager, and you start to feel like what we're saying, the anxiety, the lightheadedness, the heartbeat changing, if you already know you have a heart issue in some way, that would be a sign to now go and get some serious checkups, right?
Yes, that definitely should trigger you to go and seek medical attention when you're feeling, any of these symptoms that we talked about. And, not everyone, arrhythmias, some arrhythmias you're born with, but you may not necessarily show signs of it until you're, in your 20s or 30s. So just because, you're given a clean bill of health when you're young and then you develop these symptoms later doesn't mean that it wasn't there all along. It just doesn't manifest till a certain age.
Oh, see, that's the thing. Man, it just starts sneaking up. All these things do. It's like, and then after 40, it's like, Dr. Jackie, it's true, man. We got to work out a little bit more. It's coming for you. That extra tire just wants to wrap around my waist so fast. It's like, don't you eat that other cookie? That's a whole tire. It's coming. It's crazy. But yeah, no, it's interesting about that, how it can change. Like you could be a kid and be healthy and vibrant, and your doctor may have said, hey, this. And I wonder sometimes if parents have even passed that on to their kids, like, hey, you have a heart thing and you've got it in the back of your head, but then later it sneaks up on you. So again, going back to the lifestyle, right? That's the best thing we can do. Yeah.
Exactly.
Good stuff, Dr. Jackie. So now we're going to go have our 5 ounces of wine.
Sounds good.
We'll stay at 5 ounces. Everybody, Dr. Jackie's book is Women and Heart Disease, The Real Story. You can get it. Go to womenandheartdiseasebook.com. It's also on Amazon, all those great places. But Dr. Jackie really is on a mission for us to be living a healthier lifestyle so that we don't have to see that many white coats in an emergency situation. Sorry about the white coat comment, but seriously, I really would like to change that to be bunnies or something fun. Like, we have little cartoon characters, but honestly, we don't want to be in, an emergency situation. So really, it's about living your best life. So check it out, Women and Heart Disease, the book, go get it. And of course, Dr. Jackie is here every third Wednesday, so keep up with us at bigblendradio.com. And if you're in Southern California, you can connect with Dr. Jackie for a consultation. Go to cvwellnessinstitute.com. Thank you so much, Dr. Jackie. You take care and stay away from those white coats.
Thank you. No, thank you for having me. It's always a pleasure.
It's fun. Thank you.
Thank you.
All right. Take care.